Hello and welcome. Let's talk about non-union of fracture. So, what does it mean by non-union? Non-union of a fracture may be defined as a failure to show progressive clinical or radiographic signs of healing. This is a picture showing non-union of fracture. This is another X-ray or picture showing non-union of fracture. Now types. It may be atrophic, hypertrophic or infected. In atrophic type, the fracture gap is filled by fibrous tissue and the bone fragments remain mobile. The hypertrophic union occurs when there is excessive movement at the fracture site, leading to abundant periosteal bone formation. Now this is hypertrophic, this is oligotrophic, and this is atrophic type. Now causes of the delayed union or non-union of fracture. The local causes includes infection of bone, inadequate blood supply to one or both fragments, excessive shearing movement between the fragments, interposition of soft tissue between the fragments, loss of apposition between the fragments, dissolution of the fracture hematoma by synovial fluid, the presence of the corroding metal in the immediate vicinity of the fracture, and destruction of the bone as by tumor. Now the general or systemic causes include immunosuppression due to DM or diabetes mellitus or steroids, due to old age or nutritional deficiency like protein and vitamin C deficiency, and generalized bone diseases like osteoporosis, osteomalacia, osteogenesis imperfecta. Now clinical features of non-union. A history of a broken bone is usually apparent. The patient complains of persistent pain at the fracture site, abnormal movement, and clicking at the level of the fracture. Now radiological features of non-union. An X-ray plate of the fractured bone shows a persistent radiolucent line at the fracture. Callus formation may be evident, but callus does not bridge across the fracture. Now common sites of the delayed are non-union. Fracture site of fracture neck of the femur, fracture shaft of the femur, supracondylar fracture, and Colles fracture. Now treatment options of the non-union. In case of non-infected fracture and hypertrophic fracture, they often unite if the fracture is rigidly immobilized, usually by fixation, example by a plate, nail, or external fixator. A compression plate gives particularly firm fixation. In case of atrophic fracture, it also requires firm fixation, but healing tends to proceed more quickly if a bone graft is used to stimulate bone formation. In case of infected fracture, the union will rarely occur until the infection is overcome. The firm fixation of the fracture and excision of a bone which is obviously dead will often eliminate or reduce the infection, enabling a subsequent bone graft to be carried out. Now, in case of delayed union, it may be defined as a failure to reach bony union by 6 months post-injury. This also includes fractures that are taking longer than expected to heal. In case of malunion is a clinical term used to indicate that a fracture has healed, but that it has healed in less than an optimal position. And this can happen in almost any bone after fracture and occurs for several reasons. End of the topic.